Show really enjoyed that conversation. And welcome to Singing River Health Talk. I really have been excited about this weekly focus on my show, the second half of every Wednesday show, where we get to talk to a professional from Singing River Health System. And I had the opportunity as a result to visit before the show, during the show, after the show. And there's been just a string of terrific professionals on my show, doctors, surgeons, administrators, others, who have brought so much fire and desire to serving the community. That's kind of the way I would put it. But Singing River Health System is the real deal when it comes to that. Today, I'm excited to introduce to you Amy Weaver, who is the New Vision Administrator. And New Vision is doing some incredibly important work with their withdrawal management program here in the community. We'll talk more about that. But as I mentioned to her before the show started, there's unfortunately no shortage of people who need the focus of her specialty. And we'll tell you more about that as we get into the show. But how you doing? It's great to see you, Amy.
Good to see you too, Ricky. I'm doing well. How are you?
So when you talk to people about New Vision, and we'll come back to your path and what led you to this administrator role, how do you talk about it?
So the way I explain the service to anybody that calls or asks me about it is that we really meet people where they are. So what we do is we provide medical stabilization. It's an inpatient hospitalization stay. Average length of stay is 3 to 5 days. And we're providing medication management to people that are either in acute withdrawals or withdrawals are impending. And that can be patients withdrawing from opioid medications, whether it's prescription or not, maybe misused, alcohol, benzos, cocaine, methamphetamines, or polysubstance use.
You know, what's been interesting in these conversations that I've had with surgeons, with pain management doctors, and so on for Singing River Health System has been, maybe it's because I'm sure that it has a lot to do with the opioid challenge that we have in America today, is that there's been a lot of focus on using technology to minimize invasive natures of surgery so they can limit the amount of pain that has to be managed. A lot of focus on not having opioids be the first pain, approach. Maybe there's some other things that can be done, but I've seen an awareness today, a lot more awareness about how to keep someone from getting into a position where they have to come as a result of getting addicted in some form to opioids to come see you. But there is a lot of focus on that these days, isn't there?
There really is. The country is in an opioid epidemic. It's still ongoing. And we have been in a place and time where we have been trying to reduce these opioid prescriptions, and the inverse of what was intended is happening. We are actually seeing, as a result of this reduction in opioid prescriptions, a higher number of overdoses and a higher number of people struggling to come off of those medications. Many times it's just an abrupt end to the prescription for the patient, and they're just catapulted into acute withdrawals. So it really is going to take a lot of education for everyone to understand from a holistic perspective how to safely withdraw and get to a place of complete sobriety.
Yeah, I had a cousin actually that had a really difficult time. He had a knee surgery, and but he was aware of it. He was aware that he got through the surgery, had some pain issues afterwards. Ultimately, it got a little bit better. He ended up having to have another surgery, unfortunately. But he called me. He said, "Man, these opioids they put me on, I'm in a bad place now." But he was aware of it, and he was very proactive to say, "I need to figure out how I can get off of this stuff and get onto something else." And it was hard. It was really hard. I got to watch it through his eyes, but it's difficult. What you are all about is providing paths for people to be able to see, there's a way out of this. For anyone who's listening now that know you have a problem, this is what New Vision does for people. Tell me more about that.
Yeah, absolutely. So you're right. We provide a path. Alongside of the hospital stay and all the treatment that they're going to receive while they're here with us, they're going to be seen by a physician, treated medically monitored. They'll receive 24-hour care for the time that they're here. But we provide services from the very first point of contact. So from the very first phone call that we may have with them, we're going to be pre-screening them. We will do assessments with them. We will walk through the admission process with them. And while they're here, we also try to complete an aftercare plan for our patients. We want 100% of the patients that admit to this service to leave with a plan in place. And that is just so they have that continuum of care, so they can continue through that journey. And we have a lot of options that we can choose from when it comes to that aftercare planning. We really try to meet the patients where they are. So not everybody has the time to commit to a 30-day residential treatment program. So maybe a IOP, which is intensive outpatient treatment, is what's going to work best. Maybe it's a virtual IOP. Maybe it's just going to therapy. So we have lots of different options and different referral sources that we work with locally within the community and like nationwide.
So, Amy, what's interesting, too, is that, and I mentioned something about this before we started the show, is there's a theme, an underlying cultural theme that has sort of emanated every conversation that I've had on Singing River Health Talk. And that is that there's this underlying compassion. And I've mentioned before that I went to the University of Alabama in Birmingham to paramedic school early in my life, was in pre-med, wanted to be an emergency room physician, ultimately, changed my major, got an MBA, and the rest is history. But I'll never forget a lot of what I was taught. In fact, I'm writing a book now, and there's some of this actually in the book that I'm writing. But it's the importance of TLC, the whole notion of caring about people and connecting with people and how important that is. But, you go back and you have in your past licensed marriage and family therapist, certified health integrative medicine provider. You spent a decade dealing with behavioral health in one way or the other. You got connected to this need to connect with people to help them. And you've made a career out of it, haven't you?
I did. I learned never to say never. I decided to continue my education and move to California and get my master's degree there. And while I was going through that program, let me back up. First, I said, I'll never live in California. That was the first lesson that I should have learned. Second was while I was in my master's program, I said that this was the population I was never going to work with. It would just be the most difficult thing to do. And here I am. But it is something that I am very passionate about. I am an adult child of an alcoholic. It's something that we're no longer seeing that 2-degree of separation. Substance use is affecting us so closely now. I don't think anybody can say that they're not impacted by someone, a friend or a relative, a loved one that doesn't struggle with substance use in some way.
It's tough. It's so interesting because again, we talk about it on the show a lot, but this whole notion of you never know what someone's going through. Everybody's going through something. And the notion of how can we give hope to people? Because, hope is what makes us resilient. It makes us go forward. we talk on the show a lot of that people sometimes want to hide their scars, but sometimes the scars are their strength. And helping people sort of get through these difficult times is kind of the key to finding success in their lives. And I spent a lot of time thinking about it and focused on it. I'm writing about it. But it's so true, isn't it? I mean, you guys are about giving hope to people.
It is very true, yes. Part of the meeting criteria for our service is that our patients have to be motivated. And what that means to us is they have to be willing to seek treatment, not just go through this service, but willing to commit to continue that treatment on. So there has to be that level of hope. that they can overcome it. If that mindset isn't there, it's not going to work. That's why we have the statistic that exists right now that it takes an average of 7 times for someone to go through these levels of care in order to be successful with their recovery.
Listen, I've always been struck by Todd Trenchard from the Baco Foundation of South Mississippi, who went to 40 recovery centers before he found sobriety. 40. That's what do you know what that is? That's a statement that says, don't give up on people. Just don't give up on them. Stay focused. And when his mother dropped him off at the last care facility there in Jackson County, she didn't expect him to live. And he not only did he live, but he thrived. And now he's giving back to the community in amazing ways. Hey, when we come back, we're going to continue our conversation with Amy, and we're going to talk about, if you are someone who's thinking about these kind of services, what's next? I mean, what forms of insurance are accepted, et cetera. We'll get into some of the nuts and bolts, but we'll see you after this break. Welcome back to the Ricky Matthews Show. We're visiting with Amy Weaver, who's the administrator for the New Vision services at Singing River Health System, which is a withdrawal management program. And, we were just focused a little bit on her background and kind of, what brought her to this, very compassionately focused on helping patients find sobriety in difficult times. So one of the things I want to focus on for just a bit is, if someone is needing the services and they know they need it, talk to me about what they need to do, and does insurance cover it? Let's talk a little bit about that.
Sure. Yeah, absolutely. So being Singing River Healthcare Systems, we take just about every insurance. So really, if somebody is in need or has a family member or friend in need, the first step is just give us a call. Give us a call. We'll talk to you and answer all of your questions. I have 2 intake coordinators at both locations. So we take patients in Singing River Pascagoula and Singing River Gulfport. So speaking with one of the intake coordinators, they're so compassionate and very helpful, and will spend as much time as they need to making sure everybody feels comfortable and ready to start that journey. What they need, they just need to give the basic information, demographic information over the phone. First step that we do is to run insurance benefits to make sure that our patients are given, if there is a copay or deductible, that they're given that information up front. So there's no surprise once they arrive. And then the next biggest thing is that they, in order to meet criteria for the service, they need to be in acute withdrawals, or those withdrawals must be impending once they stop use. Yeah.
Wow. That's So and that's important for good reasons. Explain why that's important.
What part?
In withdrawal, the focus around helping people get through withdrawal. Yeah.
So if a person is let's say they're taking opioids, but they've been on this prescription for some time, and the prescribed dose is no longer as effective as it was originally, they may start to take a little more. They may take an extra pill, or they may shorten that length of time that they're supposed to, let's say it's every 8 hours. They may start taking it sooner than the time it's supposed to be taken. And they build themselves up to a place where if they go a length of time without taking the medication, they start to feel sick. And for different medications, different withdrawal symptoms look different, but common withdrawal symptoms are going to be like nausea, vomiting, tremors, hot and cold body sweats, and the list goes on. So if a person cannot go without a substance for a period of time without experiencing those symptoms, then that's considered acute withdrawals.
Yeah. So what was interesting about what you said a few minutes ago is that this is by far not a one size fits all approach. What you're going to do once they come in is sit down with them and go through the myriad of possibilities on whatever their unique situation might be, and you've really got a smorgasbord of opportunities in front of you that you can work with them to accomplish the goal, don't you?
We do. So our service takes about 3 to 5 days. They're going to be hospitalized, and they'll be treated just like any other hospital patient. They're not singled out or separated. They are admitted to the med-surg floor. So our patients are confidential. The only reason why they're here, the only people that are going to know why they're here is going to be the medical staff treating them. And I think that some of our patients have been very surprised to find that some of our very own staff are in recovery. So we've got compassionate providers, but also compassionate providers that have walked that path.
Yeah, so that's so exciting. This service that's provided by Singing River, and we got less than 2 minutes, but it's a really important service for the community, isn't it?
It really is. I'll share the statistic with you. So in 2023, our emergency rooms were seeing between 40 and 60 overdoses combined, all three: Ocean Springs, Pascagoula, and Gulfport. That's a pretty shocking number, considering, the population, the number of people that live here. 40 to 60 was really high. So I've been tracking those numbers, and they have been trending downward. And the last number that we were seeing was around 25 a month on average. So we've almost brought it down by 50%.
Yeah, that's good to see. I mean, it's a holistic effort. I mean, everyone's got to be on board with let's help solve this problem, and then ultimately, you're going to, for someone who's in the midst of it, you're going to help them try to figure out a path forward where they can, inject hope back into their lives and not be dependent. That's so important. But listen, Amy, it's been a pleasure to spend some time with you.
Thank you. I appreciate it. Thank you for having me.
You're welcome. This has been Amy Weaver. She's the New Vision administrator for Singing River Health System. As she pointed out, they have people you can talk to in both the Singing River location in Pascagoula and also the Gulfport Hospital as well. But it's been a pleasure to spend some time, as usual, with Singing River Health Talk this week. We'll see you next week as we continue that. Until then, we'll see you tomorrow. Have a great day.